When people hear endocrinology, they're usually like hormones, diabetes. But beyond that, a lot of PAs and NPs aren't really sure what this specialty actually looks like or what an endocrinology PA or NP does all day. Well, today I'm talking with Ashlyn Smith, a PA with years of experience in endocrinology who also has built her own endocrinology telehealth business. In this part of our conversation, we're focusing on the specialty itself, the good, the bad, the ugly, and to help you decide whether endocrinology might be right for you. Hi, I'm Michelle. Welcome to the Medicine Couch, where I help PAs and NPs explore real world career possibilities. So, hi, Ashlyn. Welcome. Thank you for joining us today.
Thank you so much. I'm excited to talk today.
We're going to dive right in about endocrinology. And for someone who doesn't really know what endocrinology looks like in practice, can you walk us through like what a typical day looks like for you as a PA?
First of all, endocrinology is one of those words where you say it and people's eyes kind of gloss over, but it's essentially the hormone evaluation and management. And so I usually say, I work on hormone and metabolism, and then say a couple of the conditions, and that tends to clue people in. And I would say that PAs and NPs kind of fall under two buckets. Some do just diabetes, and some do all of endocrinology. For me personally, I've done all of endocrinology. The settings that I've been in are outpatient. You do a lot of visits. So in private practice, before I started my own practice, it was a very full day. As soon as you walk in the door, back-to-back patients, seeing, honestly complex medical conditions and things that tend to have a lot of comorbidities and complications working through, but just so rewarding to partner with people and make meaningful change. So you're dealing with diabetes and its complications, you're dealing with thyroid disorders or PCOS, obesity, lipids, dealing with multiple things for the most part, and really doing a lot of education, which I love. You do a lot of patient engagement and empowerment, and sometimes working just through some tough times in their lives. So you get to know people and really partner with them through their journey. And I find that so rewarding.
I was thinking when you were talking about the different hormonal conditions, do you ever deal with like women's or men's health, like, hormones for menopause or testosterone, things like that?
Absolutely. So that definitely
Yeah.
falls under our bracket. There's a little bit of crossover with several specialties. So we have a little crossover with
Yeah.
women's health. So we do work
Yeah.
with PCOS, some aspects of infertility, but not all of them, just some aspects. And then of course menopause. We do hormone replacement therapy, and similarly with men's health. So see folks typically what that they come to us with low testosterone and doing that evaluation and management too. There's a lot of crossover with everything, though, with cardiology,
Yeah.
lipidology, of course,
Yeah.
primary care and internal medicine, obesity medicine. I could go on and on.
So what about the patient population, like in terms of age and gender? Does it skew one way or the other?
In my experience, I've done mostly adult work. I have done some pediatric endo, and they're very, very different. So just it's a very different experience. So pediatric endocrinology honestly tends to have higher pathology. It tends to be much more complex, and you're dealing with the families as well. So dealing with all of that. So conditions that are diagnosed younger are like adrenal issues or pituitary issues. You see those in adults, but it's not as common. So what I've seen typically is adults, and they're across the full spectrum though, because you have the kiddos who've aged out of peds and are needing an
Yeah.
adult endocrinologist. You have kind of that late 30s to early 40s time when a lot of changes happen hormonally. And then, of course, as people get older, they tend to have more metabolic disease as well. So it's across the board from an age experience, but endocrinopathies tend to affect women more than men,
Yeah.
just statistically. So we tend to see a lot of women because, unfortunately, I'm your demographic for most endocrinopathies.
Yeah, I don't know whether it's we, have more hormones or are just our hormones are more complex, how they all work together. But yeah, I mean, that makes sense to me that there are more women than men. uh, so you touched on it a little bit, but what kind of misconceptions do you think PAs and NPs tend to have about like actually working in endocrinology or about the specialty itself?
I think that there are, in my mind, kind of two misconceptions that I hear about a lot. One is that it's just so complex, and two, it's too much, right? It's really scary to some PAs and NPs. I have to say I've fallen in love with it now that I understand it. It is complex, but in a way that makes sense. There are feedback pathways. So if you just follow
Right.
the path, you're able to figure it out. And I think that's really, really interesting and beautiful how it all plays out. And then some
Yeah.
people have the opposite feeling where they think, well, it's just hormones. Anybody can do it. I could probably do it.
Yeah, and wouldn't it be boring every day and repetitious to do the same thing over and over?
Right. And it's definitely more complex than that. So there's a lot of investigating and putting together care plans that make sense and are individualized. So I would say it's something that you can definitely learn to do. It's very possible to learn to do it, but it takes that training. You can't just jump in. Not everybody can just do it because it's just
Right.
hormones, you know.
Yeah, so I understand what you're saying. I think that it can be very complex and it can be a puzzle to figure out, and it can be that challenge, but that at the root of things, things make sense
Mhm.
because hormones are feedback. And so
Exactly.
if you really understand that, you can figure it out, which is nice to know. It's not just almost, I think, like rheumatology a little bit is a little like, there are so many things you're not exactly sure what's going on sometimes. That may not be fair to rheumatology, and the person I interviewed at rheumatology would probably say that's not fair. But I feel like that what you're saying, endocrinology has this bedrock of like cause and effect, like that,
Yes.
or you can
There's
tell what's going
science,
on.
there's data that you can follow and get to that root cause.
Yeah.
Mhm.
What is it about endocrinology that you really enjoy the most?
What I love about it is really the investigation and getting down to that root cause, because that the moment where you go from somebody who feels awful, they feel terrible, and they probably have been feeling that way for a long time, and then you end up finding what's going on and working on it with them. It's not that people want something to be wrong. What they want is an answer. They want to know
It's
why they feel terrible. And that is so rewarding when you can start digging and work on that, work on the pathways and figure out what's going wrong. And then really seeing the change before and after is huge. But even beyond that, the as the years have gone on, I've learned to really appreciate, like I mentioned, partnering with people throughout the disease, because you get to kind of share in their experience a bit. And I would say that's something to know if you're going into endocrinology, that there are going to be those visits where the person is just, they're not motivated, they're having a hard time, they've traveled too much, or they're going through trouble in their marriage, or they lost their job, or they're dealing with depression right now. There's something else going on in their life which is going to make it hard for them to self manage, and finding a way to find the grace in that and help them through that, and then working with them to find small attainable steps that make sense with where they are right now. And then you get to see them come back and see, did that work, did it not work, what else could we work on? But then you are now partnering with them. They don't feel so alone, they don't feel so
right.
lost. You're able to work with it through them. So it's really important if you're going into endocrinology, that empathy and that kind of commitment to work with patient no matter where they are is really important.
So I was wondering when you were talking, if you identify what is going on and you get to what the root cause is, is it are you able to fix it? Like, do you get that satisfaction of being able to fix most things?
It's a really good question. And the honest answer is no. Most of
Oh,
what we
okay.
do is manage a condition, right? We don't really get to
Okay.
cure a condition, with a few exceptions. There are a couple things that we can cure, but most of it is managing a chronic condition or multiple chronic conditions.
Yeah.
So that doesn't mean
Okay.
that we don't get to our goals. We can certainly get to our thyroid goals, our A1C goals, our weight goals, but that's through managing. And then once we meet those goals, we often have to continue the management to stay there.
Right.
So most people that
Right.
end up going to an endocrinologist stay working with an endocrinologist for the long term. So while
Yeah.
we don't cure diseases for the most part, we can
Yeah.
effectively manage conditions.
Right. Like family practice, is a type of specialty that where you can develop these long-term relationships with patients. So if you like that, this might be something that's good for you.
Absolutely. When I was
Yeah.
in PA school, there was a surgeon that offered me to come work with him when I graduated. And I said, no, no, I want to work in endocrinology. And his answer was, why? Because I can fix people and I never have to see them again. That is the opposite of what you do in endocrinology. You
Right.
manage with them and you see them for a very long time.
Yeah. Well, that's what's great about medicine, though, is because not everyone's the same, and we need providers in all the spectrum. And so
Absolutely.
that's what I love to these videos. So people can find out what is best for them and what suits their personalities. We talked a little bit about the challenge of managing, a chronic disease, but are there any other challenges or frustrations that are, that you come across in endocrinology that people might not think about, whether it be insurance or paperwork or something like that?
Yeah, I mean, insurance might as well be its own four letter word. I'll figure out a way to abbreviate it. Oh, there.
Evil is a
Okay.
four-letter word.
Oh, yes. Many years in private practice doing prior authorizations and peer-to-peers. And there's a lot of that in endocrinology. So again, somebody who's willing to partner and say, this is the best medicine or the best diabetes tech or whatever it is for you. So I'm willing to fight for that. But one of the hardest things is just dealing with misinformation that's out there.
Oh,
There's
yeah.
so much that people come in with this kind of preconceived notion of, I mean, there are dozens of examples that I can give you, and they say, well, I Googled this, or my friend told me about this. And
Or I saw this video on TikTok and the
exactly.
person said,
And so you're now, instead of spending your time educating and treating and helping to manage, now you're dismantling the wrong information to help rebuild the correct
Mhm.
information, and kind of having to rebuild trust in the medical system, because that's often goes with these kind of out there, diagnoses or out there treatment plans, is this message that we're somehow hiding it from people, or we know all these answers and we're not willing to give them. So having to deal with that misinformation and that distrust in the medical system, that's challenging. I think that's more challenging than treating endocrinopathies.
Yeah, I can imagine. And it really has gotten so much worse, right? People think that and I understand there are some root things that medicine is slow to change or slow to adapt and slow to, give up the dogma of things that
Mhm.
we've been taught. But for the most part, uh, we're up to date on things, and it is frustrating. The implication is that we just want to keep people hooked on medicines, and we don't really care about treating people and stuff. So yeah, I can only imagine you must deal with that a lot. So I wonder, what does autonomy look like for PAs and NPs in endocrinology, at least from your experiences? Do you work very closely with your supervising physician, or are they just there if you need them? And are you seeing new patients or just doing follow-ups? How does that work?
I've seen different examples of this in my own experience and in experiences that my colleagues have had. So it definitely varies. It varies by level of experience and which state you're in and what kind of practice you're in. So, for
Mm.
example, I was in one practice where I worked very closely with my supervising physician. I did see new patients and follow up patients, but I saw every new patient and then gave report to my supervising physician, who then also went to go talk to the patient. So that was a little bit more involvement than my next job was much more hands off, because at that time I had been practicing for over 10 years, and we had a level of trust there. So it was more just kind of a co-signature on a couple of things, but I saw all my patients autonomously, new patients, follow-ups, all of that. And then what's really cool is that Arizona has a collaborative practice certification. So if you have been practicing for at least 8,000 hours in your specialty, you can apply to get a collaborative practice certification. And then once you've attained that, then you don't have to be limited by the scope of your physician. Because, under supervising
Oh, okay.
physician, you have to follow the physician's scope. But in collaborative practice, I have a collaborating physician, and I don't have to
Mm.
use her scope. I use my own scope that I've spent years building. So it's a little bit
Yeah.
different. At least that's how it is in Arizona.
So then your license isn't tied to them necessarily. Like, um, I'm just curious, it's kind of a little off topic, but like in a supervising physician situation, if something happened to the supervising physician, like I would have to stop practicing. Does that work the same way with collaboration? Like, or do you always have to have somebody on board
I always have to
same
have a
way as
collaborating
supervising?
physician, right? So
Yeah.
if for some reason she retired, I would need to find another collaborating physician before I continued private practice. But there's a lot less, like in terms of number of chart reviews or co-signatures. We don't have to worry about that at all. And then in terms of how frequently we meet, we get to choose how frequently we want to meet. And I don't have to file anything with the Arizona Regulatory Board. I just have to keep a copy for my own record. So it's less, really, it's not as rigid.
Paperwork and red tape,
Yeah.
yeah. So you mentioned that you've worked all outpatient in endocrinology. I didn't know there was like an inpatient
Yeah.
endocrinology. So what do they kind of cover when they do inpatient?
I did a rotation in inpatient endocrinology.
Okay.
So I saw some of it, and then from others' experiences in it. So you'll have the patients that come in that just have an endocrinopathy, like they have diabetes. So they need to be managed while they're in the hospital. So there are
Mm.
those situations, but there are also, say somebody's going in for a surgery, like maybe they have Cushing's and they need to have an adrenal gland removed, or they have to have pituitary resection, some sort of actual endocrine
Mm.
procedure. So then they'll need to have that procedure and then be monitored in the hospital. And then you have your very rare endocrine emergencies, like, of course, hypoglycemia, DKA, thyroid storm, adrenal crisis.
Mm.
There aren't many, but they do exist. So if they were presenting with
Okay.
that emergency, you would manage that as well.
And when you said procedures, it made me think in the outpatient setting, I can't think of any procedures you would do, but am I wrong about that? Or is it all cognitive or do you do any hands-on things?
I personally have not done the procedures. I know there are some rock star PAs out there who, do thyroid biopsies, and they do procedures. Again, that kind of depends on what your practice is, and if you
Right.
if you're in an environment where they kind of support training you to do that. So most of what I do, though, is managing, in terms of what I do, managing insulin pumps and diabetes tech. We do a lot of risk assessment too. So, risk calculations and such. But as far as hands on procedures, they do happen. FibroScan, doing fatty liver assessments and thyroid tests are the majority of what would be done outpatient.
Okay. And so in an outpatient, your schedule, for the most part, from what you've seen about, I'm sure you know other people in this specialty, I assume it's more like a Monday through Friday, regular hours type things. Am I correct in
You are
that?
correct.
Yeah. Is there any call or anything?
I've not experienced any call. No,
Yeah.
I think
Yeah.
that would be very, very rare. And yes, it is usually just
Yeah.
a typical Monday through Friday, normal business hours type of a schedule.
So what time are you usually getting in and what time are you usually getting out every day when you were working for the last practice?
With the last practice, yeah, it was a straightforward 8 o'clock until 4:30, Monday through Friday. So really, really.
But I mean, were you getting out at that time, and when you're coming in that time, like, because I want to give people the real, we can say that the hours you see patients are one thing, but how long, were you really staying there?
So with documentation and everything, with the sheer number of patients, I was never actually done at 4:30. I know, I
Yeah.
think I can count on one hand the number of times. So the charting is a lot. That's usually what it is. So in traditional private practice, that's not the way I've structured my practice, but in the traditional private practice endocrinology, it's, 20 plus patients a day, and you're just going back to back to back. I often worked through lunch. Now, that is probably more of my inability to set healthy boundaries than anything, but it's a lot of documentation because you do go through and you have to document all like the education that you've talked about and the tests that were ordered, because endocrinology, we order a lot of tests too.
So were you often taking charts home, or were you still able to finish them usually in the?
Most often I would finish it at work because I'm just more fresh if I do it right away. If I have to think
Right.
about it later, I am going to go so much slower. So for me,
Yeah.
the drive home it would have made me work so much later. So I'd rather just get it done and drive home and be
Yeah.
done.
And so let's talk about compensation in endocrinology. If you could give a range, or if you could tell us like how it may compare to other specialties to give people an idea.
So that, in my personal experience, has varied wildly. It's so very different. So when I was working in private practice, there I was under the impression that that would have been kind of the higher end of the spectrum. But I did, when I was working at the VA, surprisingly, that was much better compensation than
Oh,
private practice. So that surprised me quite a bit. So
yeah.
if that's holding you back from working at the VA, maybe take a second look.
And I have to say really quick about the VA too. I've noticed, because I've spent time looking at different VA jobs around the country, trying to get an idea. It does vary wildly too,
Mhm.
based on the actual VA center, even within a state. Like one center pays way better than another one. So if people have looked at a VA job and saw they're offering like 92,000 or something like that, they may be like,
Yeah.
no, and think that the VA is all terrible. But I also have seen jobs that have been way higher on the VA than I thought that they would be. So yeah,
Yeah.
good to point out
It
that you have
it
to double
may
check.
work to just kind of look around a little bit. Yeah. And I do think it matters the years of experience too, because when I started, that was many, many years ago too. Um,
Right.
started off much lower, sub 100 for sure. And then
Yeah.
now typically I would say in the low 100s is a lot of what I'm seeing out there.
But when you say the low 100s, are you talking like, 105, or are you talking like 120 when you say low
Yeah, like
100s?
120s, 130s. Yeah. Yeah.
Yeah. Okay. Yeah. Yeah. So about around the average,
Mhm.
and some places can be higher depending on what it is.
And we have
Okay.
to keep in mind too
Um,
that unfortunately endocrinology is the lowest paid specialty. So it
like for physicians in
Right.
general and stuff.
So what they're
Right.
getting
Yeah.
back in reimbursement, that we have to know that that is affecting what they're able to offer, because even though
Right.
we're dealing with complex chronic medical conditions, for some reason lowest paid specialty.
Yeah, because it's, the fee for service, and usually things when you can do
Right.
procedures and different stuff ranks higher than actually being able to talk to people and counsel them and educate
Yes.
them for whatever reason. Crazy.
I know.
So you said something about when you entered endocrinology, and I don't know if I caught that correctly. Did you go into endocrinology as a new grad, or had you had some other experience
Good
before that?
question. So I structured my PA education, like my rotations and everything, around endocrinology because I knew that's what I wanted to
Okay.
go into. So my first job was actually in internal medicine, but I was
Okay.
hired as their insulin pump person because
Okay.
the physicians did not want to touch an insulin pump, and the PA that had been handling the insulin pumps was moving into a specialty. So I was doing internal medicine, which I honestly I would recommend doing some internal medicine, some primary care in the beginning. I think that's really valuable. But I was doing it kind of as a point person for
Right.
their insulin pump patients. So even if you're working in primary care internal medicine, you still can carve out a niche for yourself and
Yeah.
be the CGM person or the pump person or the obesity person, something like that. You still can carve that out as that kind of being your special interest.
Yeah, I think that's a great point, and something I always try to drive home too is you don't have to change from family practice to a
Mhm.
specialty necessarily. If you are interested in something, you can try to make that like your niche within the practice, because there's going to be, like you said, other people. Those doctors didn't want to deal with the insulin pumps. They're happy to funnel those patients to
Exactly.
somebody who wants to focus on that. And so, whether it's while you're working in family practice or internal medicine, learning and going through CME, or maybe getting your certified diabetes educator
Mhm.
certificate or something to up your knowledge and help you make that niche even more rock solid. Then, if you want to transfer to a specialty later and you've already got this niche practice and you can show all this that you've been doing, you're actually coming into the specialty with experience, and you can actually demand a higher salary too, because you've
Have the
proven that you,
experience. I
yeah.
like, yeah, it's a win-win. You get the cases that you enjoy. The other providers don't
Yeah.
have to deal with the cases maybe they don't enjoy, and
Right.
then you get the experience too. 100%.
Yeah, and a way to test out also if you really do like those. I
That's a
mean, you
good
may,
point.
like you said, you had an interest in endocrinology the whole
Mhm.
time, but sometimes people have an interest in something and then they get into it and they're like, this isn't really, it's not really what I thought, not really like what I like to do. And so doing that niche practice helps
Yeah.
you like dial in too, and to know if that interest really is real or
Mhm.
not. So my next question was going to be, is this new grad friendly? And so I'm hearing you say it
It could
could
be.
be in the right.
It could be.
Yeah.
If you have the appropriate support, I think it could be. If you're somebody like me who just knows that that's what you want to do, then, I structured my rotations and my capstone projects and everything were structured around endocrinology. So
Yeah.
specifically honing those skills. And then, I could have entered into an endocrine clinic and with if there was somebody who was willing to help support me as a new grad. So I think it's possible. You just have to find the right environment to support that.
And when you said you structured your, rotations focus on endocrinology, for somebody who may not get an endocrinology rotation or have that option, or even if they do, what are the other rotations that you feel are the most important that really help you anchor in your endocrinology knowledge?
If you're lucky enough to find like an obesity medicine rotation or a lipidologist to rotate with, that could really help. But there are some other kind of
Yeah.
common specialties that have a lot of overlap, like I mentioned earlier. So, gynecology, there's a lot of overlap, cardiology as well. And then, honestly, even just internal medicine, you'll end up seeing a lot of endocrine there. If you're interested in ped endo, then of course trying to do pediatrics would be a good choice too. But yeah, there's still a lot that you could kind of slant match to endocrinology and
Right.
get some good experience.
Yeah, and I also recommend people who are going to be going through rotations and who are really focused on getting a job in a specific rotation is to log as many cases as you can that touches on that specialty, so that you can show potential employers like, look, this is the cases I saw, and I did extra studying and focusing on these, which is just a little things to make you the better candidate, right? So what about resources that you might recommend for somebody who is working in endocrinology or considering working in endocrinology?
As I mentioned, there's not a certificate program for endocrinology specifically, but there are some good resources and there are some other programs that might be helpful as well. Of course, I would be remiss not to mention that I am a resource as well. So I'm happy to help educate. I've been doing medical education for now 13 years and love to teach patients and clinicians alike. So I'm happy to help out with anybody who's maybe thinking about entering endocrinology, or maybe you're just seeing a lot of it in your practice and you want to strengthen that side up. I'm happy to help with that.
And in your business that you were going to talk about in a separate interview, but part of your business that you're developing too is educating providers, being a paid resource where they come and like learn specifically from you and walk through cases,
That's
correct?
correct. So I have, of course, the
Yeah.
patients that I'm seeing, and then kind of the second arm of the practice is the clinician coaching. Just from years and years of teaching clinicians and hearing kind of the same feedback is, how do I learn more about thyroid disease? How do I learn more about
Yeah.
osteoporosis or CGM? And I love doing
Yeah.
it. So the clinician coaching is the another aspect of my practice.
Yeah, and I'll put a link to that down below if anyone's interested in reaching out to Ashlyn. So besides that, what other resources, societies, books, any things like that you would recommend?
I would highly recommend the American Society of Endocrine PAs if you are in endocrinology or even something related to endocrinology. We have some, I'm past president, so we have some family medicine and even some, bariatric surgery PAs and different things that are related to endocrinology. Within that organization, you get medical updates. So as new endocrine topics are coming out, new studies are coming out, they do free CME as well. And there's also a membership directory. So if somebody's moving to Wisconsin and you need to find somebody in Wisconsin, you can search for an endocrine PA in that state. They have a Facebook group, so a lot of good ways to like network and get close to endocrine providers, as well as getting those updates and free CME. There are also a lot of other, I think, a lot of other good resources that can help you along. I personally love the American College of Lifestyle Medicine. It's not endocrine specific, but they deal with a lot of chronic medical conditions. And there are tons of resources of evidence-based lifestyle intervention that you can use, patient assessment for like motivation and readiness to change. I mean, those resources are incredible and they're so applicable to endocrinology.
Yeah.
And then I also love ADCES, what used to be the diabetes educator. So ADCES, they have a robust body of information and very active group. They're called community of interest, where they have like little sub communities for different areas of interest. So you can kind of network that way. And definitely, there's always the BCADM certification if you're looking to focus on diabetes. So there are, I didn't
Yeah.
even mention all of them. There are so many of them, but
Yeah.
those are probably my favorite: the American Society of
Yeah.
Endocrine PAs, the ACLM, and then ADCES.
Great. Well, thank you so much, Ashlyn, for taking your time and telling us about
My
endocrinology.
pleasure. Anytime I get to talk about endocrinology, I'm there.
If you're still trying to figure out which specialty may be right for you, then you can keep exploring by clicking on this playlist right here. Thank you so much for watching. And as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.